You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more traditional dentures. We're talking about mini dental implants today. With us, we have an expert on the topic, Dr. Fregia. Dr. Fregia, welcome to the program.
Thank you, Randy. It's great to be here.
Now, for people that don't know you, and I know you brought a lot of photos and some models, but for people that don't know you, tell us a little bit about your practice. Who's your typical patient? What are the different procedures that you do?
Bet. Well, I practice in West Texas.
Okay.
Been there for 38 years. And we're right in the middle of the oil patch where all the light, sweet crude comes from. Friendliest people, great place to live and
How long have you been there?
38 years.
38 years.
Yes. And typical patient, we're simple people. These are the typical bubbas right out of the oil patch sometimes, blue collar. Some people call us oil field trash, and we're proud of that. That's okay. We're not, you know, and they talk plain and
straight. So you grew up there?
No, I just moved there because I thought it might be a good place to have a dental practice in 1975.
So the procedures you do a lot of different things.
Yes.
Because you do more than just the mini implants.
Oh, yes.
Tell me about like the procedures you do.
We do a lot of things, Randy. I feel like I have the best job in the world, and because of that, because people come in, I don't know what they're going to need. They might be in pain. They might just have a chipped tooth, or they might have 4 teeth knocked out from a barroom brawl the night before, or maybe they want to straighten their teeth, or maybe their dentures are literally flying out of their mouth, and they want something they can chew with that doesn't hurt. The reason I'm on this show, Randy, is real simple. Okay. There are thousands, tens of thousands of people in the Permian Basin watching this show right now that they hate their teeth because they're false teeth, and they're sliding around inside their mouth. You know, the good Lord never meant for a piece of plastic to be stuck on your lower jaw and think that you can chew. It doesn't work that way. God put roots on top of the teeth. Okay. And so what we're doing is just simply showing people how they can get roots inside their jaw.
So like mini implants to secure, like they snap on?
Yes.
Is that right?
Yes. And take their own denture, their very own denture, which saves them a ton of time and money, and walk out that day with their denture stuck on the roots, very much like the good Lord gave them from the beginning. Okay. And now they're ready to eat the very first day. True story. Now they're a little bit tender, and they might need a little Advil, but typically,
it does seem painful. It does seem painful.
It's unbelievably simple.
So they don't complain about pain for the most part?
The reason it's simple is because there's no cutting. Most of the time, there's no incisions. We just simply screw them in. In fact, I'm going to show you later a fellow that had a couple of them put in, and he went out and played golf that afternoon with my blessing. They're that simple. We can put them in medically compromised patients that, you know, maybe they're just not super healthy, but we can screw them in because we're not making them bleed.
What are the age ranges of patients that you see that come in to do this?
Well, this is the fun part. All ages, from age 13 up to age 86.
86-year-olds are doing this?
Absolutely.
Why would they want to do this?
Because they want to chew again. They want to laugh again. They want to love again. They want to live again. Every time people get together, they eat, they laugh, they hug, they kiss. And all those things, in one way or another, involves your teeth. You don't realize that till you lose them. And the reason I'm on this show is I want these people to know that are watching this show that they can come in and they can leave the same day with their teeth attached to something that's fixed, their own dentures.
You know, I think I told you in the green room, but when we talked on the phone, I made some notes.
Yes.
And for people that work here at the studio, I got off the phone with you because I thought, boy, this is going to be a boring conversation on the phone. I got to interview a guy, you know, for denture work. And I was excited. Really? And I did. I told everybody here, I said, this guy really is on fire. People also need to know this is a real interview. I'm not endorsing you. I'm not on your side here. I'm just asking the questions. But you love this. I mean, this is your passion.
I do.
But something you said, I want to back up. You said there's thousands of people? Is it that big of a problem, people with upper and lower denture?
Tens of thousands.
They're all over the place?
They're all over the place. They really are. It's a sad thing. And the most exciting thing, though, is watching that life-changing experience. It's just, I call it a game changer. And not just for the patient, but my staff loves it. They love doing these, and it's a game changer for all of us because they become our friends, our family. We love them.
So many people that have this problem, upper lower denture, and it's so good. Why aren't they all doing it?
They think that they don't have to go see the dentist anymore. They have these false teeth. They don't like them. I don't know anybody that truly loves their lower denture, including the father of our country who had to wear them. He hated them, and they're the same for us. But the good news is once the patient learns that they can take that denture that they hate, and magic appears, because when they get that denture put on top of an implant, of the implants, now that denture's got stability, and they can chew, and everything stays in place.
So the denture wearers just don't know this option is out there? Is that what you're saying?
It's just
because they don't go to the dentist.
That's exactly right. That's exactly right.
And they think it's expensive, more expensive.
Well, some of them have been told, they've gone and had it checked, and some have been told it's $20,000 or $25,000, and it's going to involve a lot of surgery, a lot of grafting. These little guys that we put in.
So we're talking about mini implants are different than traditional implants.
Yes, yes.
And these are less expensive.
Yes.
But are they effective?
Their studies have shown that they're just as effective, and that's the exciting thing.
What about the older person? It seems like they would fall out. My thinking.
With the implants in?
Yeah, yeah. So, I mean, dental implants, I'm saying dental implants. I mean, you said 88-year-old or 82-year-old.
Oh, yeah. Well,
aren't you at higher risk of them falling out if you're that old?
Randy, see if you can pull that off of that denture.
Is this accurate, by the way?
That's accurate.
Okay.
Now, that's how tight.
This is not a setup.
No, this is not a setup. Now,
very nice.
Are those going to come out?
Let me show you. I guess underneath
that's the patient's existing denture. We take it, modify it a little bit while they're there. This all takes about an hour.
Show that to the camera, if you can. Okay, so pull that off. So this is like a traditional, regular denture, but underneath there, hold that for a second. Just little facets that just go on top.
Yes.
Interesting.
Yes. It's a little metal attachment with O-rings on the inside, and the O-rings grab the implants very tight, as you found out. You had a hard time getting it off at first, I noticed.
I will admit.
A lot of our older patients, they can't get them off. I actually have to soften the O-rings because they're so tight. So no, these do not come out once they get them in.
I mean, you'd love to wipe out dentures, traditional dentures in your town.
Yes, yes.
So I guess it's a challenge just getting these denture wearers in the door.
Yes, yes. And I know that these patients have gone through a lot of trauma. They probably had some rough extractions, maybe some root canals, a lot of abscess teeth, a lot of bad experiences at the dental office. This is one procedure that when the patients come in, I've never had one that truly have felt any pain during the procedure. And when they walked out, they weren't bleeding. And some of them get to go play golf the very same day if they want to, just simply because they're so non-invasive. And that's the reason I do them. They're economical, and they don't hurt. And the two things that patients worry about most is how much does it cost and is it going to hurt?
It does seem painful. Well, during the process, it doesn't hurt, obviously.
Yes.
So what do you give? I mean, you give them pain meds for the next day?
Never. I've never given them any pain medication. We just tell them, if you need any pain medication at all, just take a little Tylenol, a little Advil. Let me give you an example. I had a patient, Mr. Ted, I'll call him.
Okay.
Mr. Ted comes in from 200 miles away, and he's wearing dentures, and they're loose. And he hears that I can get something under them quickly in one day. That's why he can drive 200 miles to come see us. So he comes in, and we do the procedure, and we ask him, can you spend the night with somebody? He says, oh yes, my daughter lives here.
All right.
So he spends the night with his daughter, comes and sees us the next day.
Okay.
And guess what?
What?
We didn't see him for months. We started worrying, and I told my staff, I said, we need to call Mr. Mink, see how he's doing. And Ted says, well, I'm doing great. I'm not hurting at all. And we said, well, you know, we really would like to see you just to see how you're doing. He says, well, I'm not hurting one bit. So we said, well, God bless you, Mr. Mink, and if you need us, give us a call. Well, Mr. Mink came in to see us just the other day. He's had him now for about 8 years.
And 8 years?
8 years. And he came in to visit his daughter. And she was getting some dental work done, and he was there, and he had to come seek me out just to shake my hand. And he walked back to the back, and he says, Doc, I just want to say hi and thank you again. My teeth were fantastic. They've never hurt me, and thank you for coming in.
So this guy, snap in,
yes,
snap out,
yes,
dentures,
yes,
and you could eat. I mean, give me an example of what you could eat.
I don't know.
What do they ever tell you stories about what they
I don't know of anything they can eat. I know that in our area, there's 3 things everybody wants to eat. They want to eat chips and salsa.
Okay.
Okay, West Texas. They want to eat corn on the cob, and they want to eat apples.
So they could eat apples. And how soon can they start eating?
Well, as soon as they're comfortable. They can literally eat the very same day if they want to. But they're going to be a little tender and sore, of course. They just had these little mini implants screwed into right through their gums. So the gums are sore. The bone's not sore. It's just the gums sore. It's like you just maybe nicked yourself with a toothbrush, and they're just kind of tender for maybe a week or two. And then they're off to the races. They're eating literally any and everything.
Now, you do traditional dental implants too, or now you're pretty much, but mostly you do minis?
Yes.
These mini implants.
I did a lot of traditionals in the 80s and the 90s. And when the mini implants came out, and it was proven that they also hold up under fixed work, and they were primarily designed for these full dentures, which they really, really work well for, I have moved my practice over to where I'm doing mostly all mini implants.
And you think that that's the best way to go?
Well, it is for the person who doesn't have a lot of money.
Okay.
Somebody who doesn't want to go through a lot of surgery. They don't want to have a lot of pain. And they don't have the time to keep going back, 4, 5, 6, 7 times. Same day.
So somebody watching this, no teeth at all, can go in, walk out with something snaps in, snap out, and in some cases, even a fixed set of teeth, a full arch of teeth don't come out? Absolutely. In the same day?
I know that sounds hard to believe, Randy.
It really does, actually.
But it's true. We've been seeing it for too many years. And I do it on my own family.
So you put mini implants on your own family?
I have a 37-year-old son that has 2 implants in his mouth. My wife, my beautiful wife, has one.
We've met her.
That you can't even tell which one it is, can you? It's one of these front teeth up in the front here.
Okay. All right.
One visit, far easier than taking the tooth out. Taking the tooth out's the hard part. Putting the implant back in is a piece of cake. You can leave and go right back to work.
So if all the denture wearers watching this were to decide, I'm going to go in there, see what this is about, could you even handle the business? Are there that many people?
No, we couldn't handle all of that. We would have to get
But if they knew what you knew, would they all do it, in your opinion?
They would all do it, no question.
Is that right?
No question.
Good for you.
Because they're not looking at a whole lot of money.
So is that your mother right there?
Yes, this is my mother and father.
Okay.
Mom was not blessed with good teeth. Mom, she was raised on a hog farm in Missouri, and they never went to the dentist, so she lost a lot of her teeth. And I honestly think one reason I became a dentist, Randy, is simply because I wanted to put some teeth back in my mom.
Good for you.
She died a few years ago, but she died happy with 10 implants in her mouth, replacing, every time she'd lose a tooth, I would put another implant in there for her. I put a combination of traditional at the beginning, 15, 20 years ago, and then more recently, the rest of them are all the small diameter.
Is that a fixed set of teeth, or they snap in, snap out?
Fixed teeth. Randy, the eyes don't lie. Look at her eyes and look at her smile.
Okay.
Can you see how beautiful she looks? Can you see how the teeth fit? They look natural. And she's not worried about those teeth moving around.
Yeah, they don't look like dentures, that's for sure. I feel like I could spot dentures walking down the street, by the way.
Exactly.
So these can look cosmetic.
They can look fantastic. And they can cough, sneeze, laugh, and never worry about them coming out.
And your father?
Yes, my father actually has no teeth at all. But about 20 years ago, he was one of my very first patients when I was first learning, and I put a giant implant inside of his mouth on the lower jaw, and it was a horrible surgery.
Giant implant?
It was horrible. We had to cut him from extendus. It was very painful, but bottom line, he died with those in his mouth, and they lasted well over 30 years.
But knowing what you know now, would you have put mini implants in him?
Absolutely.
20 years later?
In a heartbeat. Because I could have gone out and played golf with him the very same day, which we did for the last few years of his life. So, yes, I wouldn't have put him through the trauma of all the surgery. Absolutely not.
So, Dr. Fregia, we're going to take a quick break. But we have a clip of your office manager, who also thinks you're the best dentist in the world.
Okay.
What could you tell her about her? Because she runs your office.
Yes. Well, she's an amazing woman. She's also my wife.
She's your wife. Yeah, I knew that.
She does have a dental implant. It's one of her front teeth, and I challenge our viewing audience to be able to tell which one it is. I don't think they're going to be able to tell. She's beautiful. I'm biased. But
and both of you believe that you're, and I say this respectfully, but that you're changing lives.
Yes, we are.
That's the big picture here.
We're changing their lives, and it changes our lives.
How?
Because we love these people. They come back and they thank us, and we grow so close to them just because they're sweet people. Like I said, we have the best people in the world out in West Texas. We truly do. It's ugly to live out there with the hot weather and the desert. But
you say you're on an oil patch.
We are in the middle of the oil patch. We absolutely are. But the people are the friendliest people in the world.
Good, good. Okay, we're going to take a quick break. We come back, more of these photos. We're talking about no more traditional dentures. You can get a fixed set of teeth in the same day, in just a couple of appointments, or in certain cases, the same day.
Same day.
Same appointment. We'll be right back. I'm Randy Alvarez. You're watching The Wellness Hour.
Well, I think Dr. Fregia is the best dentist in the world, but I'm biased because he's my husband. But I will tell you, I see so many transformations because I work in the front part of the office. And I'll see people come in and they'll be fearful, very fearful for things that actually have happened to them in their past. And so we have to be very careful and sincere working with real phobias. But he's so gentle and he's so kind and he's so excellent in his field. The most rewarding, though, is where they say, this actually changed my life. And that's why we do what we do. They're eating again, they're laughing again, they're smiling again. And one guy actually came in recently and he said, I'm going to fix all my teeth, because he goes, I'm going to date again and I want to get married, and he says, I've got to fix my teeth. And it is life transforming. It's just incredible. And I think that we love what we do so much, and my husband is excellent at what he does, that whenever you help someone, really you help yourself. And when you see a life changed, it changes you. And I think that's why we love doing what we do so much.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures with mini dental implants, no more traditional dentures. With us, according to my first guest, he says nobody should be wearing dentures, traditional dentures. Dr. Fregia. Dr. Fregia, welcome back to the program.
Thank you.
So your wife, who's also your office manager,
yes,
she believes in this.
Yes, she does.
She loves it. She's like you.
Yes.
Do you ever go home after a long day and you guys are still talking?
Oh, yes. We're high as
Seriously?
a kite. Yes, yes.
High as a kite.
There are certain patients that we treat, and we'll talk about them through the evening while we're just sitting there relaxing and sometimes totally exhausted emotionally just from giving and helping. But yet, the joy of just seeing these people leave, and then you see the light come in their eyes when they realize for the first time, my teeth don't move around anymore. My teeth that I walked in with that I hated are now fixed in my mouth, and I can actually chew. And so Pam and I, we just, we get off on that. It's good stuff.
On the consult, so a patient comes in, they're wearing a denture.
Yes.
They must ask most, like the same questions every time?
Yes.
And what are those?
They want to know how much does it cost, and is it going to hurt, and when can I start eating?
Do they ever ask what I'm asking, which is, are they too old? Because it seems like the old, but you're saying the older patient, fine.
The older patients make the very best.
But do they think that they're too old sometimes?
Some of them do, but they think they're still young. When they look in the mirror, they realize they're not anymore, but they want to feel like they used to feel. Randy, I had a gentleman come in, and he was in his mid-70s, true story, and he wanted his dentures to be tied into his jaw, like we've been talking about. We did it. Well, first of all, he leans in at the consultation and he says, Doc, he says, Doc, when I was making love to my wife the other night, my teeth fell out. And he says, I was so embarrassed. And he truly was. I mean, felt badly for the man. He says, I just want to know that my teeth won't come out, that they'll stick in. And I can assure you, after he just had the minor modification to his existing denture, he never had that problem again.
So like him, are there a lot of people where something happens, maybe around the grandkids, or I mean, where they've had enough?
Yes.
And they finally come in? But you want to get them earlier, you say. That means nobody should be wearing regular dentures.
That's right. Well, we don't mind that they're wearing their denture. In fact, sometimes they don't know, and maybe that's all that they can afford at that period of their life. But circumstances change, and people and technology makes things get cheaper and cheaper and cheaper over time. And when they figure out that, by golly, I can actually get these lower dentures that I'd rather just throw into the lake, I can actually get them and they're going to fit and they're going to stay in my mouth, and I can actually chew steak again and eat chips and salsa and corn on the cob. They get excited, Randy, and you can just see the light in their eyes. It just, and we love to take after pictures and show that light, because now they've got true joy.
Okay, good, good. And does everybody pretty much say I should have done this years ago? Is this one of those things?
Yeah, it typically is. None of them ever regret it. They're all of them. It's a game changer, total game changer. For example, let me tell you about the patient that I put him in, Mr. Cisneros. I hadn't seen him in many years. And I was eating a steak at Logan's restaurant with a friend of mine, and he walks up to the table, and he's grinning ear to ear. He says, "Doc, guess what?" I say, "What?" He says, "I just enjoyed that wonderful steak with my dentures and the implants you put in. I want to thank you." And he puts his hand out and wants to shake my hand. This is the kind of thing, those of us that do this, this is why we do it. This is why we love to put these in. We know it's going to be a life-changing experience.
Good. So the specialists that watch this,
Yes.
the oral surgeons, the periodontist, what could they say to this? And what do you want them to know about what you're doing?
Well, I say God bless them. They're doing a terrific service. Traditional implants are fantastic. No question about it.
So they work, for sure.
They absolutely work. But not everybody has the kind of money that it takes to get traditional implants.
Okay, okay, fair enough.
So the small diameter implant, I'm going to compare it to a Ford 150 pickup truck. It gets you there, and there's a million of them in West Texas. It just gets you there. And there's a few people that can drive the best of the best, the Mercedes-Benz, the Lamborghinis, and God bless them. No question, you know, that's a great automobile, and they absolutely work. But frankly, we need to do a better job in our profession in finding ways of putting affordable procedures in front of the patient that they can afford, that's a life-changing experience. And they're getting the same benefit as the patient that can afford the gold standard, so to speak.
So you must believe in it. And the only reason I'm saying that, I'm not trying to side with you, is you put one in your son.
Yes.
Your wife has a mini implant.
Yes.
And your own parents had
Yes.
mini dental implants.
Pam's
So
parents.
you believe in it.
Yes.
Because that's about 80% less, 70% less than traditional
I would
implants?
say 50 to 75%
Okay.
less in most cases.
Okay.
Yes.
Now we're just about out of time. So you brought some more photos
Yes.
of people.
This patient here is a very interesting patient. That is her smile. That's how she lived her life for many years.
Okay.
And she just simply wanted to smile. And
You
look
know
good.
her. You know her. She.
Oh yes, yes. This is my assistant's mother. She actually makes a wonderful homemade Mexican dish, and she brings it up to us every once in a while. We love her to death, and we just want to do something nice for her.
But you say this is her version of a smile.
That's her smile.
Okay.
Yes, yes. And we want to do something really special for her. What we ended up doing for her is we put in. Here's a couple of afters of her.
Nice.
We not only put in teeth and screwed them in with the little mini implants, but we put permanent teeth over the top that she can never take out. Now, look at that smile now. Now, you can't stop her from smiling now. She's a wonderful woman. In fact, she just recently had surgery just last week, and every time a doctor would go in, he'd say, "Now be sure and take those teeth out." And the nurses would laugh and say, "Doctor, those are not false teeth. Those are her teeth. They're in there. They're fixed. You're going to do that surgery with those teeth in." And that's how natural that they look.
And she could eat. How old is she? Approximately.
I'm going to guess in her early 70s.
Okay. Because that's young in Texas. That's young these days. 70s.
It is. It really is.
So that's the ideal candidate. Somebody
Yes.
70s,
Yes.
early 80s.
Yes, definitely.
Not too
Definitely.
old.
Definitely.
What about pain for her?
Honestly, I didn't hear of any pain at all. She probably took an Advil or a Tylenol, but didn't bleed, and she was medically compromised. She's somebody that I would never have laid a flap on and done a conventional implant for that very reason alone. But these little minis are so non-invasive that she's a perfect candidate for it. Randy, let me show you this one right quick, if I may.
Okay, let's take a look.
This little gal came in mid-80s, and some wonderful patients that have been patients of ours for many years wanted to buy her some implants underneath her full denture and turn her denture into something magical that works. That's a picture that was taken yesterday in Odessa, Texas, with Kathy, my right arm, one of my chief dental assistants in the back. And her her words were, I believe if I remember correctly, Pam could tell you more, but my life changed forever. It's totally different, totally better.
So people got together and came up with the money and helped her get these.
Yes.
So she could have something solid in her mouth.
Absolutely.
Snap in, snap out.
Absolutely.
Dentures.
Look at her eyes. It tells the story. I mean, the joy is back. Now she can chew. She can eat again, smile again. I have the best job in the world.
I think you believe that. Good for you. I mean, it sounds good, I have to admit.
It is true.
You know,
it really is.
We are out of time. Final message. Denture wearers watching this, they're skeptical.
Yes. Yes.
What do you say to them? Maybe they're worried about pain. Maybe they think they have osteoporosis.
This little picture here, this is my 95-year-old aunt. True story. First year out of dental school, we're standing on the dock up in Lake of the Ozarks in Missouri. She sneezes. Her teeth fly out of her mouth when she sneezes. It goes in the water, and here's her teeth doing this as they're floating down in 10 feet of water. Wow. And my sweet Aunt Bernice saying, Jimmy, my teeth, go get my teeth. Well, she was laughing and, and crying at the same time, and it was a nice family reunion. Of course, I got a bathing suit, went down, got the denture for her. My point is that people don't have to live like that anymore. She accepted that. That generation accepts it. But the new generation are learning. Thanks to shows like this, they're learning. They can take those old dentures that don't really work so good, and they can turn those things into magic teeth again that actually work.
Good. Excellent. Oh, thank you for coming to the show. Great stuff. Love your enthusiasm.
Enjoyed
if they want to make an appointment, they can go see you.
Yes.
Consultations.
We won't charge for the initial consultation. We'll just talk to them and tell them some stories and give them some names that they can call right there in West Texas and find out for themselves.
How soon, when they walk in the door, will they know if they can do it, if they're a candidate?
Right away. We can. I'll try them on anybody, because you don't need very much bone for these little implants.
Okay, good. Well, thanks again. Great information. Then go to your website and find out more. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could visit our website at wellnesshour.com and just put in Dr. Fregia. If that's tough for you to spell, just put in Mini Implants, Texas. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.